Welcome to Kindly Neurodivergent with Kay. Today I have Alina Kenner with me. She will be discussing holistic health as it relates to medicine, dental and vision, and the relationship to human movement, nervous system regulation and trauma, and how that impacts pain, etc. Welcome, Alina.
Thank you for having me.
Before we start, a quick note. This episode is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. And if you notice any pauses during this episode, we ask you to keep listening. Sometimes, someone's processing their thoughts or it's part of the natural flow of conversation. Can you share your journey into athletic training and how you developed your holistic approach that connects medicine, dental, and vision with movement?
Yeah. Well, first of all, thank you for having me. I'm so excited to be here. I love podcasting. It's great. My journey into athletic training is the journey. I just knew that I wanted to work with human movement and with people. I always loved people and wanted to learn about how people are in the world. And I was an athlete myself. So I decided to go learn in University of Arkansas to do athletic training. And what that means is instead of like personal training, a lot of people confuse athletic training and personal training. So athletic training is more the rehab, injury prevention, injury rehabilitation component, also emergency medicine. And personal training is more of a strength-based modality to teach people how to get stronger. And there is a lot of crossover, but it's not the same. So I wanted to really work with injured athletes. So that's what I went to school for. And then after school, I kind of realized that everything I had learned in school didn't necessarily perfectly help all the patients that were coming to see me. So that's how I started to develop my holistic approach. And as I continued to learn and started to learn something called postural restoration, I learned more about the dental and vision component with movement. And I think our medical system is so siloed now that people don't even think, oh, my eyes or my teeth or how my feet touch the ground could be related to how I feel in my body and how my nervous system acts. But if you just think about going back to like babies, when you're starting to move and starting to learn the world, those are where you pull in all your senses. So, of course, they all connect to how we feel and our human movement.
Is it only for injuries, or would you work with like me?
I don't think we're as like, I would say that it's mainly for injuries, but then people specialize afterwards. So if they wanted to work with more disabled or different types of people, you can do what works for you. But I do think you need more education. Yeah.
I did track in high school.
Really? That's amazing. I worked track at University of Arkansas and it was such a wild experience and it's probably one of my biggest regrets that I never ran track myself because it is so good for you and so healthy. You're like moving through space, your body's able to alternate side to side. You have optic flow, so things moving in your visual field on the outside as you're moving forward. It's so healthy, and it's just in reality, we're meant to move and walk and run, and track teaches you how to do that properly. So that I think track is amazing.
I horseback ride too.
I had a feeling because of the horses in the back. So what's so interesting about horseback riding, and I've worked with a few people that horseback ride equestrians, the horses respond to your body. You know because you horseback ride. Horses are also extremely intuitive animals, but when you are asymmetrical internally and if those asymmetries aren't managed properly, the horse will feel it. And I have not spent enough time on a horse, but I went horseback riding for the first time, like as an adult last
Therapeutic
year.
riding.
Therapeutic, but it is very therapeutic. But it's also very difficult, and I don't think people realize how hard it is. I went on a horse last year and it was insanely difficult. And I was shocked. And the horse wanted to do whatever it wanted. I was not in control.
I do dressage.
Oh my gosh, that's like basically horse dancing. And that's I've worked with some people that do, and they know their horse. Like you know when the horse is on versus if the horse isn't. It's so fascinating.
What inspired you to focus on uncovering the root causes of chronic pain and body dysfunction?
I just felt like I wanted to be in the world of like sports and in human movement, and I struggled with school, and I just was fascinated by anatomy and physiology and human bodies since I was very young and what we can do. I just always thought it was so crazy. Some people can do amazing stunts with their bodies. Look at the Olympics. And I just knew that if I went into that field, I would find what fit for me. I just didn't really know growing up what I wanted to do. I just knew that I liked sports and I liked human bodies. So I was like, I'm just gonna figure it out as I get there. And as I continued to learn, I it was the right path for me because I'm still passionate about it.
What are the body's natural asymmetries, and how do they contribute to chronic pain or dysfunction?
Really good question, really important question. So we all, except for like a very small subset of people, but most of us have a diaphragm on the right side that is bigger than the diaphragm on the left side. We also have a liver that sits on the right side that's pretty heavy, 3 pounds on average. And we have a heart that sits more to the left. And we also have lungs, 3 lobes of lung on the right, two on the left. So these internal asymmetries actually are normal and natural, but when we see things externally or when people are not managing their internal asymmetries, that's when I kind of will see pain, dysfunction, issues occur. And a lot of it is very lifestyle based.
Our head is heavy too.
Our head is very heavy and it's heavier because of all the screens that people use now. And just with the phones, the texting, our head coming forward, which makes it heavier. But we can still be on screens and it not come forward. We just have to be cognizant of it and do things to combat that. So a lot of what I do is breathing techniques.
Mm, mm, mhm.
Example.
Yeah, good question. Everybody always asks me, like, what are you talking about with breathing techniques? So they're very specific. They're in certain cranked positions, torqued positions. And the reason being is that because of our asymmetries, sometimes we end up having an easier time breathing on one in certain areas of our body. So because of those human asymmetries, the diaphragm bigger on the right, it attaches lower into the lumbar spine. We have liver on the right. Our body tends to shift more to the right leg. And then we'll see the left side almost like it's coming forward. So it's almost like we're crunched down on the right, forward on the left. So a lot of our breathing techniques are opposing that movement. Of course, you always have to test first and make sure people are in that position. But for the most part, I do see that. And we can give these breathing techniques that help retwist the body back to center, something like that.
And it is different from chiropractor.
Yeah, although chiropractors are starting to learn this, like some of them are starting to want to study this. So I originally went to school and studied regular traditional medicine, and then I studied this. But it is different than chiropractic care, but a lot of chiropractors are starting to learn it. And I think that if chiropractors were to learn more of this, it would be amazing because I think they have such a great background with knowing a lot of different components of health. And I'm starting to learn a lot of what the chiropractors, some of the education that chiropractors are learning. So they can coincide.
And it is different from regular therapy.
Yes. So regular therapy, like physical therapy and athletic training is similar to physical therapy. Yeah, they do a lot of like strength related things, but that doesn't always mean the brain understands that. And so a
Mm.
lot of people have a hard time with it because it doesn't transfer over into life. I am still a huge fan of strength training, but I think that there are neurological components that need to be addressed first in many ways.
Of course, I understand that.
Yeah.
Mm.
Yeah, of course. And it's interesting because you understand it more than maybe a regular person, right?
Yeah.
But everybody walking around has neurological deficits due to our inherent asymmetry. And so everybody can benefit by learning more about their nervous system and what they can do from a neurological perspective.
What is our neuron system in biological perspective?
That's such a good question. Um, I think that our nervous system at this point, our nervous systems were developed like in utero, and also there's a generational component to the nervous system. They found that certain people who went through, I'm Jewish, for example, so people who went through the Holocaust, that nervous system, that trauma sits in generations later. So I do think that there's a massive component of biology that influences our nervous system, but I also think what we do every day can influence our nervous system. You mentioned
Yeah.
you liked horses. Horses influence your nervous system because they're
Yeah.
able to calm the system down. You probably feel amazing when you're around horses because there's a nervous system regulation component that the horse could give to anybody. So animals, I think, in general, do that for people. That's why we've domesticated cats and dogs. That's my thought. I don't know if it's based in scientific
Every
evidence.
week.
Every week you horseback? Wow.
Mm.
So yeah, so you're getting this like complete neuroregulation when you're
Yeah.
with a horse. And horses are known even more to be able to optimize the nervous system just because of how intuitive they are and how
Yeah.
you're intuitive with your horse. Do you go on the same horse every time?
Yeah.
Yeah. Wow.
8 years with my current.
Wow. So 8 years with your current horse. So you know that horse. That horse knows you, and there's a regulation that's happening with that connection.
Yeah.
And people wouldn't think that that has anything to do with um, what I do for work, but it truly does because everything, pain, dysfunction, struggles in life, trauma in life, always really goes back to that nervous system.
especially since you focus on injury.
Exactly. Exactly. But, and, injury, whether it's someone went through a very traumatic childhood, it could really be a lot of things, but the techniques that I use help with that. But I also think that what people do outside of my office is more important. I'm with somebody for 1 hour a week. If they can do things that get them into nature, get them with animals, get them being able to regulate, pain goes away. So I work on the asymmetries and I give them something to do. But in reality, if somebody just is in a environment where they're never getting outside and never being around animals, never getting that regulation, it's going to be harder.
But how do you determine when pain is a medical issue?
Well, technically, it's almost always a medical issue because it's a problem. The brain is signaling that there's a problem in the area, but it's never really that area that's the problem. And it almost always goes back to other things, emotional component, um, trapped emotions, or there might actually be like a traumatic injury that happened. But I really believe that everything is intertwined and happens for a reason. So yes, it's a medical issue, but how I treat it is not the typical medical approach because I don't always think that
But
works.
how do you determine when pain is an emergency?
Okay, so I don't really see as many emergency issues, but I was an EMT, so I feel like that is a good skill to have because I can tell when there's going to be any sort of emergent issue. If someone's going to faint, and I mean, I guess that's fainting's not really a medical emergency, but if somebody is going to have a bigger emergency, then I would be able to tell. And in school as an athletic trainer, we're very trained on concussions and head injuries. So there's that. And we're trained, CPR and all of that stuff too, just in case. But I don't typically see that as much now in my career now, but I'm grateful I have that background. So in case I ever needed to use it, I could.
Are you surprised that you don't?
Um, Not, I'm not that surprised that I don't treat more in like emergent situations because I think at this point people are sending me or people that are coming to me have tried a lot of things for their issue. And so they're what let's say it's low back pain. They might have seen 10 providers. But what's interesting, even if I don't see as many emergent issues, I see so many chronic issues. And today there's so many chronic issues. Everyone they're on a lot of medications. They're struggling with chronic diseases. And a lot of these diseases are lifestyle diseases. They weren't born with it. It's not congenital. They have issues from maybe how they're eating, how they're not exercising, things like that. So that is always interesting to me.
How do these asymmetries affect the nervous system in trauma recovery?
Yeah, so when I see a lot of asymmetry or people that are in pain and they have asymmetry together, I would say that they don't affect the recovery, but the nervous system dysfunction is very tied into how asymmetrical a person might be or might be showing. Um, or usually we'll see, let's say they have dentally they're very off or visually they need a pair of glasses, we can help using the senses from the eyes and the teeth to relax the nervous system. So it's like what I do when somebody comes to me can actually help so much with their nervous system, even if I'm approaching it from a different sensory component.
How do the respiratory system, dental occlusion, and visual system work together to influence posture and movement?
Yeah, so kind of like what I was saying before about how using those senses can help with the nervous system. When you have a solid, strong nervous system, and you're working on this sensory component, posture typically changes. It's not a crazy thing that when I see somebody come in and they have a very poor posture, which we can discuss what is poor posture versus good posture. Everybody says that. Everyone points to themselves. They're like, "Oh, I don't have good posture." But that's not always true because a lot of times people will think that their posture is not good, but actually posture is respiration. So it's all dependent on how you breathe. So if you can change how you breathe, posture can change very quickly.
I have developed good posture through therapy.
Oh, well, that makes sense because when you've actually worked on it, it can change and it can change quickly. But everybody comes into my office and they're like, I have terrible posture. And then I look at them, and some people don't have the best posture, but we can make changes. Like you just said, you've changed it through therapy. It can change. Also, when you ride horses, sometimes just knowing your body in space can really make a difference there.
Yeah.
Any sort of athletics can play a role.
I always say sensory integration is not talked about with cerebral palsy.
You think it should be talked about so much because it's sensory integration is related to the nervous system and the neurological component, and CP is that. Um, it's interesting. I have only worked, I think, with maybe one person with CP, but I do think that it could be so powerful, some of this PRI stuff for CP. But I also think a lot of the therapies for CP are already integrating some of what we do.
Everyone thinks sensory and motor are different.
No, they're tied into one because they influence each other,
Yeah.
you know? So yeah, maybe sensory is what you're feeling and motor is how the ability to move, but you can't
Yeah.
really separate it.
No.
You know.
Yeah.
What does this collaboration look like in practice?
So when I'm working with dentists and optometrists a lot because there's a sensory component that can change the motor component. You can't, you really can't separate it. And so what we're doing is, it's funny because I've never thought about it that way, and I'm going to start using it more like that because I think it people will understand when you can say like sensory and motor go together. But when I'm working with the sensory component of the teeth, for example, when we bite down, we have a ligament in our teeth called our periodontal ligament, and it tells our brain where we are in space. So that sensory component of biting down allows us to have better motor component of where we are in space. And it's the same with lenses. You put lenses in front of your eyes, it's going to kind of shift where you are in space. So it's a sensory component for a change in your external environment.
What role does nervous system regulation play in chronic pain and healing?
Well, that's like what I was saying with the horses. Like, I don't think every single person needs to see somebody like me. I think most people need to go outside, be in the sun, be in the nature, surround themselves with what makes them happy, what brings them joy, to be with other life forces, animals, other people. And I think a lot of times that is enough to change the nervous system for people. I think what I do is a great modality, but I don't think it's everything.
Any tips for winter?
Oh, that's the hardest thing because there's not many things. Where are you located? Because I'm in New York, so it's cold. Um, I think that the best thing you can do in winter is leave your cold place and find some sunshine, take a vacation. There's also something called the Spurdy vitamin D lamp, which I can send you a link. And I have a code to it. I think it's just my name, but it is a full spectrum vitamin D light. And so it's a UVB light. And so we get four different types of wavelengths from the sun. We get UVA, UVB, near infrared, and blue light. And everybody talks about blue light, but nobody talks about the other spectrums of light. When we go outside and we go on a walk or we just are outside, we are getting all those spectrums of sun into our body, and it's very healing. And so in the winter, I live in New York, we're not getting UVB that much. So this light is UVB. So I do recommend that in the winter.
I thought blue light was bad.
Yeah, so blue light gets a very negative reputation, but we actually need blue light in the mornings because blue light helps to wake us up and tell us it's daytime. The problem is artificial blue light from screens. Me and you are both on a screen right now. We're both getting artificial blue light. That's just the nature of it. And we're only getting that. We're not getting the other three spectrums of light. So there's no full spectrum. And the LED lights, that all the light bulbs are LED lights, that's also really very high in blue light. But when you go outside in the sun, you're getting blue light mixed with near infrared, with UVA and UVB, and that mixture is actually really beneficial for us and for our nervous system to heal. So there's nothing really wrong with blue light. What's wrong is getting it in isolation with none of the other lights and getting it too many hours throughout the day.
What signs might indicate someone's chronic pain or dysfunction could be linked to dental or vision issues rather than just muscles?
Yeah. So let's say I have a bunch of questions that I'll ask for both dental and vision, and I'll give you a little rundown of my questions. So with dental, I'll ask people, do they have whatever pain they have? Is it worse in the morning? Typically, it's worse in the morning because they're grinding, they're clenching, they're doing something with their mouth at night. That's one big thing with dental. And then with vision, I'll ask if it's worse at the end of a day because they're using their eyes all day long. And if their eyes have a hard time working together, that could be related to lack of a more energy use in their brain to just get their eyes to function well together.
Thank you, Alina, for being on the show.